welcome to another episode of Ask Dental Views. I'm Dr. Sundar Iftikhar, and with me I have Professor Dr. Abdul Samad Khan and our very special guest, Dr. Saroash Shahid. Assalamu alaikum.
Yes, assalamu alaikum.
Okay. In the previous episodes, we discussed what Dr. Sarosh's expectations are from prospective PhD and MSc students. So we're going to carry forward this discussion, and we're going to ask Dr. Sarosh what his expectations are from his PhD students when they arrive in UK. Like, how do you expect them to behave professionally as well as ethically, or if you have any other expectations from them academically? So what are those?
Thank you. I mean, the main thing once they arrive in the UK is probably for them to get settled in, and they will be given some time for that. So either if they've already applied for student accommodation, they'll know where they are. If they're staying with friends or family, they'll know where to go. So once they're settled in, they might need a few days for that. Then they inform their supervisors, arrange a meeting with them. Best thing I would suggest, because you're meeting for the first time, don't just turn up at the department or the lab to meet with the supervisor, because maybe they're not in that day, or maybe they're tied with something else, or maybe they've got lectures. So it's always best to remain in email contact with them and tell them that, okay, I've arrived. What's the sort of next available day when I can come in and meet with you? And so that they know that they're coming, the student is coming, and meet with them. So in the very first meeting, obviously we'll show them around the lab. We'll introduce them to other people in the lab or in the department, introduce them to other PhD students which are either in the department or the supervisor is supervising, involved with, just so that to get them involved, show them where they're sitting and all that sort of normal introductory bit. And then from there onwards, slowly they'll sort of engage them. So obviously from the very first day, you're not expected to start in the lab from day one. It's more about getting to know them, understand them, giving them time to settle in, introducing them to fellow students and group workers. If they need some sort of an induction, particularly health and safety induction when they come to the labs, their health and safety training, they'll have to do that. Giving them some papers to read so that they can get an idea about what, about the research project. If we've got a student who's working in that sort of an area, similar area, we will ask them to meet with them as well, so they can show them around, show them the results they've got, if they're doing some experiments, to get that done. And then from there onward, gradually bring them into, some supervisors ask the student to spend some time doing a literature review. Some supervisors prefer to take the student straight into the experimental work once they join. I prefer to take the other route, where you get them straight into the experimental. So give them some initial reading, and then within a few days of them start coming to the labs, get them to do some minor experimental work, just so that they know what they're doing, things like maybe mixing a composite, making some samples, preparing some solutions, or showing them if some other student is doing some experiments, getting them to observe them, so that they get an understanding of the equipment they're using, the techniques they're using. And then from there onwards, gradually, the work will increase, the lab experiments will increase. In the PhD, we've got several progression points. And I think that's the same all across the UK. So the first progression point is at 9 months. So 9 months after starting the PhD, the students are expected to submit a 9-month report. By that time, we don't expect them to have extensive amounts of experimental work, but what we are expecting them to know at the 9 month is to understand the background of the research which they're doing, understand the aims of the research which they're doing, have some knowledge of the techniques which they're planning on using, and they should have a timeline for what they're going to do for the next 4 years, up to where they'll be submitting their dissertation. Now, the 9-month point is very, very critical, because at 9 months when they submit the report, they'll be then have a viva with two independent people, two independent researchers, which will not be the supervisors. And they will then assess to see if the student is fit enough in the sense of their knowledge and what they presented to continue their PhD. It very rarely happens, but it can happen where the examiners feel that the student does not have the knowledge or progression at the 9-month stage to allow them to continue doing a PhD. Although that's, as I said, it's a very, very rare occurrence, but that can happen. Usually at 9 months, what the examiners will do, they will assess the project, they'll assess the knowledge, and they will give some feedback. And that feedback will help the students sort of prepare and plan. And they'll also discuss with the supervisors and give them feedback as well. So that's a very helpful point at that. But in very rare cases, if the student does not understand the project, they don't have a clue of what experiments they are doing or of the aims or the background, then in that extreme case, such an extreme decision might be taken where they are asked to deregister and not continue with the PhD. So after the 9 months,
has it ever happened to any of your students? I'm sorry.
I think let's leave that question. As I said, it's a very rare occurrence. It's a very rare occurrence. In the department where I'm working at, I don't think that we've had such an occurrence. But it can happen. But I would say it's a very, very, because it's not very easy for any examiner to say the student don't. The only point they will say that is if the student has never ever engaged with the project. They've never actually done any experimental work. They've never read the papers which the supervisors gave them or have had that discussion with the supervisor. So in that sort of an extreme case, only that can happen.
And I'm sure with the admission criteria, which is so rigorous, there hardly will be any student who doesn't work.
It's very rare. Yeah. So after the 9 months, then they have 18 months. At 18 months, they are expected to submit a comprehensive literature review. And also they should have substantial amount of data by that. And again, also a plan of the remaining time on their PhD. Again, so at 18 months, you can deregister a student at any point, but it's very rare at 18 months that such a thing can happen. Again, it's very highly likely because students will have done some work. So again, it's a viva. So the whole point of these progression points is to actually constantly keep the student engaged, and it also trains them for the final viva, because that's what's going to happen in the final viva. You will have two independent people who will just assess the project and the understanding of the candidate based on their thesis and their viva. So it sort of trains them on that to critically think, critically analyze the data, because that's one of the key things about doing a PhD. You need to critically think and critically analyze the data, not just talk about the strengths or the positives of the project, but also understand where the limitations of the project are. Not just do experiments because the supervisor has asked to do the experiment, but actually understand the reasoning behind those experiments. So a PhD is a complete journey. I mean, when the students start, initially they require quite a bit of hand-holding. It's a bit like learning to drive a car or learning to ride a bicycle. Initially, you need to have some guidance, but by the time you're in year 3 or towards the end of year 2, the supervisors expect the student to be a bit more independent. When we have meetings with the students, we expect them to have a discussion with us, not just tell us, oh, I've done this is the data, but they want us to tell us, this is what I've done, this is what the data is showing, this is what it means, and this is what I think we should be doing next. So it should be a sort of driven by the PhD candidate at the end, because that's the whole point of doing a PhD. It's a training in becoming an independent researcher. So PhD is not the end of the journey. It's actually the start of the journey.
Beginning. Yeah.
Yes, it's
so I have a background in education, and we use this term scaffolding. So, when you give support and then you gradually take it away, and then the researcher or the
Yeah.
They become independent. Okay, yeah. So thank you so much for a very detailed response. So correct me if I'm wrong. So PhD in UK does not have a coursework, and they have these progression points, which will ultimately determine whether a student gets their PhD degree or not, right? So how many progression points are there in a PhD program?
So we've got 9 months, we've got 18 months, and then we've got 36 months. So 9 months and 18 months are submission of the report and a submission of and also a viva. The 36 months is just a report submission, where you're basically submitting a plan, because by the time you're in 36 months, you're just about to go into write-up. So mainly you're submitting a plan of your write-up at the 36 months. So you don't have a viva there, but the two independent examiners, they will then see, okay, if they're on the right track to submit the thesis at the end of 4 years. Because the main thing, the reason why we've got these progression points is actually to make sure the student is on track to submit their thesis at the end of 4 years.
And is there a time limit? Like, for example, if a student, for any personal reason or for any other logistical reasons, they're unable to complete it in 4 years, is there a deadline that the university has that the student has to complete it in a minimum or a maximum of this period of time?
So the maximum period is 4 years. There is that
Okay.
that cannot be changed. But like you said, if there are any personal circumstances which have impacted the student during the course of that PhD, then yes, there are processes in place for the student to take interruption if they want to take interruption, or have a discussion with the director of postgraduate research to see what options are available in terms of extending that deadline. That happened during COVID, for example, where a lot of students were affected by COVID because the labs were shut down. We also had incidences where the students or somebody in the family were affected by COVID as a sort of an infection, and sometimes there were unfortunate incidences. So again, we had to take steps in to support these students, give them the required extension which is needed so that they can submit their PhD.
Right. Okay, that's about the PhD students, and not talk about the MSc students, because PhD students, they are bit of mature students,
Yeah.
Whereas MSc students, they are mostly fresh graduates. Okay, and one of the reasons which I from my experience when we came to UK, it's the cultural difference, not the cultural difference of the countries, cultural difference of in the education system.
Work ethics.
Right. So what do you suggest for those MSc students, those who are coming right now, or they will come in future to UK? So what's your opinion and what's your suggestion for them?
You mean in terms of sort of the work ethics and that sort?
Yes, like how, because it's already a 1-year program, and in that 1 year they have to fulfill their coursework, they have to finish their research project, and obviously, especially when we are talking about the dentistry, right? Most of the dental students, they normally take admission in either in oral pathology, oral biology, or dental materials. Subjects in their coursework are totally different from the clinical dentistry. Like this was in dental materials when we came. So we had to take like advanced dental biomaterials, tissue engineering, biosensors, of course, material selection and design. Similarly, I think the same type of subjects are there in oral biology and oral pathology, which are not very much related to the clinical dentistry. And that's actually a shock for the students.
Yeah.
So that's I want to take your opinion.
Yeah, no, I think that's a very good point. So obviously, when we are studying at an undergraduate level, the expectation over there is very different. It's more about learning, and the exam questions are more like define this or give that equation and etc. When you come at level 7, the question style changes. It's more about discuss. And so it might be on the same topic. So we might still be asking questions on, I don't know, structure of a tooth or a structure of enamel, but we're not asking you to give information which you've memorized, but actually discuss that. And in the level 7 question, an MSc level question, there isn't really one correct answer. What we're trying to see is, okay, so we had a lecture. In fact, we prefer to call them seminars rather than lectures because, again, these are there to engage you in a discussion, to keep them more interactive. So the learning style in an MSc is going to be more interactive. It will still be in an undergraduate, but over here it's more interactive. It is get you to think outside the box. Once you've had the lectures, it's not just about memorizing what's there on those lecture slides, but actually to sort of take that knowledge, then go to the library, read research papers, expand on that knowledge, expand on that information, because that's the sort of questions which will be asked in the exam, where we're trying to see what you have sort of learned after taking that information from that knowledge and then expanding on that through your own reading, through your own research. So that's the sort of learning difference between an undergraduate and a postgraduate degree.
Right. Okay. Yes, Sundar, any further questions from your side?
No, I think that's about it. And Dr. Sarosh, would you like to add something to the entire discussion?
I think I'll just add on to what Dr. Samad was saying there just now about that we are coming to a new country, and everything is going to be very different to what we are used to when we are at home. The first thing, you'll be independent. You'll have a lot of responsibilities on your own, and alongside those responsibilities, you'll have to manage your sort of learning, your education. So time management is very, very critical. Whether you're doing a PhD, whether you're doing an MSc, yes, you will have a timetable when you have an MSc, but in addition to that timetable, you're also expected to do some self-learning on your own. So don't expect that, just because you follow the timetable, that's all you need to do. You also need to dedicate time for your self-learning. In an MSc, you'll also be given coursework, essays. Again, you will need to dedicate time on that. And it's very important that the students engage with their course, regardless, again, it's any course, MSc, PhD, or D.Clin, Dent. Because from experience, I can tell that the students who don't perform that well in the program are the students who don't engage well with their courses, with their lectures, with their projects. They don't have very good time management. The time where they should be spending towards learning something or attending lectures, they dedicate that time elsewhere, thinking, if they're doing a PhD, they might say, I've still got 4 years. Or if you're doing an MSc, I've still got tomorrow to do it. Well, the unfortunate thing is that tomorrow never comes. And by the time you realize that, it's too late.
Right. Okay. Related to this, and just the last question, like the expectation of a student from the supervisor, because some of the students, or mostly the students, they believe that the supervisor, he or she will be available all the time. And that's their perception and expectation. So what's your message for them related to this?
Yeah, again, I think, that this is true for any sort of degree which has got a research element. The supervisors are there, definitely there to help the student, to support the student. But like you said, they're not there 24/7. They will be available at some times. And also, the students need to understand that they are not the only student they are supervising. They will have a lot more other students, maybe undergraduate, MSc, D.Clin. So also they will have their teaching commitments and other commitments, research commitments going alongside as well. So it's very important that they realize that if they've got a deadline for something, for example, for an MSc dissertation, they've got a deadline end of August, because usually in September they then have their viva. Don't send it to your supervisor on 30th of August, expecting them that they'll give them back with their feedback the next day. That will never happen. Always give plenty of time. Sometimes supervisors might be on holidays or vacation or engaged somewhere else in conferences. So again, I think time management and planning is very, very important once you start doing a postgraduate degree.
Right.
Thank you so much, Dr. Sarosh, for your time. And with your permission, I'm going to share your email ID in the description of this video. And for the viewers, if you have any comments or any questions for us or for Dr. Sarosh, you can drop them in the comment box. Thank you so much for your time, Dr. Samad and Dr. Sarosh.
Thank you very much. It was a pleasure. Thank you. Really enjoyed it.
Thank you very much. And I think it was a very nice discussion. And I hope it would be beneficial for our students or the dentists, like those who are looking for to take the admission in UK. Right. Okay. I think because these are the things which I think we didn't know at that time. Now, with such type of discussions and such type of podcast, I think people, they can take some messages, or they should have something before going to, to the other country. So thank you very much. Thank you, Sarosh, and thank you, Sundas, for asking so many questions.
Hopefully, Dr. Sarosh is not going to get a lot of emails from Pakistan.
Yeah. No, I mean, that's fine. If they've got any question, I'm always happy to answer any questions.
Okay. Thank you.
Okay, thank you.
Okay, thank you so much. Allah Hafiz.
Allah Hafiz.
Okay, Allah Hafiz. Thank you.
Recording.
जी सरोज, अब आप recording
एक सेकंड recording में stop करना।
हाँ, recording